Welcome to the training course, Breast Cancer Screening, Optimizing Mammography Services for Women with Disabilities. This course was created in collaboration with the Cerebral Palsy Foundation, the Rehabilitation Institute of Chicago, Access Living, and the Lynn Sage Breast Imaging Center at Prentice Women's Hospital, a part of Northwestern Memorial Hospital. This course is sponsored by the 100 Women in Hedge Funds as part of the project Transforming Healthcare in Women with Disabilities. During this course, you will learn about the best practices for working with women with disabilities to obtain the highest quality images possible for the screening of breast cancer. You will hear not only from physicians and technologists, but also from women with disabilities. While all participants will discuss some of the challenges and solutions for optimal mammography, our peer educators, who have been instrumental in the production of this training course, will share personal experiences in receiving breast health care and demonstrate some of the challenges that may arise in receiving a mammogram as a woman with a disability. This course will first review known challenges in providing ready access to high-quality mammography services to women with disabilities. We will then focus in on safety considerations for both the patient and technologist. We will spend the majority of this training demonstrating specific exam strategies. Our team of technologists and peer educators will provide live-action detailed instructions on mammography positioning and both standard views and modifications that may be utilized to accommodate physical limitations a patient may have. With the assistance of our peer educators, our technologists will perform some of these modifications. Finally, we will address scenarios and solutions for when mammography is not the best screening option for your patient.
I have been practicing radiology for slightly over 30 years, and my main focus has always been on the early detection of breast cancer. And this is frequently achieved through the use of mammography. But the important thing is that it needs to be quality mammography.
There are two main indications for mammography. Screening by definition is performed when a woman has no symptoms involving either breast, or diagnostic by definition is performed when a woman has symptoms involving either breast or surrounding tissue such as palpable lump, focal breast pain, or nipple discharge, or has an abnormal screening mammogram.
Over the years of doing this, both teaching mammography to technologists and physicians, as well as interpreting mammograms, we frequently come across where the mammogram may not be quite optimal. And the simple excuse from the technologist that a patient is unable to be positioned because of physical limitations is not readily acceptable, because these women do deserve a quality mammogram.
I think the biggest challenges for women with disabilities in receiving medical care is that their healthcare providers, as well as they as patients and women, understand that they are at the same risk. I think we've got to remember that disability never inoculates us from getting cancer or any other medical conditions.
Women with disabilities are not getting screened at the same rates that women do without disabilities. And we also know that in the cerebral palsy population, women are diagnosed at a later stage of the breast cancer. So obviously, if we can get them to do their screening and they get diagnosed earlier, then maybe we can have the interventions be more effective.
Breast cancer is the most common cancer diagnosed in women in the United States. Second only to lung cancer, breast cancer is a leading cause of cancer-related deaths among women in the United States. In 2015, approximately 232,000 new cases of breast cancer were expected to occur among women in the United States, and 40,290 breast cancer cases were expected to result in death. Mammography screening has been shown to reduce breast cancer mortality rates by as much as 30%.
According to a National Household Interview Survey that was done in 2010, which included women of ages 50 through 74, 75% of women without disabilities had a mammogram within the past 2 years, compared to only 61% of women with disabilities. Mammography rates may be even lower for women with childhood onset disabilities, something like cerebral palsy.
Screening recommendations. There are multiple risk factors, the most common in which include women who do not have children at higher risk. Women who have children later in life may be at higher risk. Personal and family history of breast cancer and ovarian cancer. personal or familial BRCA, or other genes indicative of predisposition to the development of certain cancers. Previous breast biopsies demonstrating atypia. Behavioral risk factors, smoking, drinking, diet. Every woman should speak with her doctor about her risk factors and when she should first have a screening mammogram and how often she should have a follow-up screening to ensure early detection of breast cancer. The goals of this training course are to understand the importance of high-quality breast cancer screening for all women, including women with disabilities. Identify the specific needs and concerns of women with disabilities when scheduling and performing a mammogram for a woman with a disability. Learn effective communication skills for optimal interaction and patient comfort during a mammography exam. Identify challenges and review best practices for technologists to ensure the safety of both the patient and technologists when performing mammography. Discuss strategies to address challenges of imaging. Demonstrate advanced skills for modifications of mammography positioning. Most importantly, empower the woman with a disability to partner in her healthcare.